Hello there, I'm Lorrie Rivers, and I'm the founder of the Relief and Transformation course for Long COVID and ME/CFS. And we're going to be talking today to Dr. Scott. Aha! Hey, Dr. Scott. So, Dr. Scott, there you are.
Hey.
Perfect. Hello.
How's it going?
Hello. Good. How are you?
I'm good. I'm sorry I'm just on time instead of early. I know you wanted me to be early.
Oh, no, that's fine. It worked perfectly. Perfectly.
Excellent.
Yeah. So just to do a quick introduction, if you just joined us, I'm Lorrie Rivers, and I'm the founder of the Relief and Transformation course. And that's for people with long COVID and ME/CFS, which is chronic fatigue syndrome or myalgic encephalomyelitis. And let me introduce you to Dr. Scott Sherr. We're going to be talking about something really cool today. It's combining methylene blue with red light therapy, and this is really powerful. So I'm excited about doing this. So Dr. Scott Sherr is board certified. He's a board certified internal medicine doctor, physician, and he's also the COO of Work Smarter, Not Harder, which I love the name of that company. And one of the things that they do is they create methylene blue products for people to use.
Mm-hmm.
So welcome, Dr. Scott. Thank you so much.
It's good to be with you, Lorrie. We had a fun time on our podcast. I know you have your summit coming up, and I think we just kind of barely scratched the surface on topics. And so, yeah, I'm happy to be with you and answer questions that your community has questions about and that you have questions about. And as you said, I am an internal medicine physician. I'm board certified in that. I specialize in hyperbaric oxygen therapy, but I also specialize in an integrative approach in everything that I do. And methylene blue is sort of the therapy or the compound that has kind of infiltrated almost everything that I do over the last several years, because it's such a fantastic compound and does so much on the cellular level and the mitochondrial level to truly support people.
Yeah, I can't remember if we talked about this in our other conversation, but when I was doing research about it, it's actually what the term magic bullet was coined about. They were talking about methylene blue when they came up with that term.
Yes, I know. It's not known that that's the case, right? Something that was initially the dye for blue jeans back in the mid-1800s, becoming the first drug registered with the FDA back in the 1890s, the only antimicrobial available until the 1950s, until antibiotics and antimicrobials came around. And now one of the most potent mitochondrial enhancers that we have. It's a pretty cool history, for sure.
Yes. Yeah. So let's talk some more about methylene blue, and then we'll go into red light therapy. And, I've been getting some really good questions already just through people DMing me over Instagram. So so let's talk more about methylene blue. What is it? How does it work? Why does it work? Yeah. And let's talk about, real quickly also, none of this is medical advice. Please make sure that you check with your doctor beforehand, all that good stuff. So, yeah. Okay, and go.
Okay, thank you for that. Yes. So methylene blue, as I said, has been around a long time. We've known over the last couple decades that for our purposes, it's a fantastic mitochondrial enhancer. So it helps with energy production in your mitochondria. It helps create more ATP, which is your energy currency. And at the same time, it builds up something called antioxidant reserve, so that when you make energy, you also make what are called waste products of energy metabolism. Some of these we all know, like carbon dioxide that we breathe out, water, but also something called reactive oxygen species. And these are important in small amounts for signaling purposes in our cells. But when they get to be too much, it can cause the cells to start breaking down, the mitochondria to stop working as well. And so we need antioxidants to neutralize that reactive oxygen species, that ROS, the oxidative stress is another way it's termed. And what methylene blue does is not only is it helping you with energy production, but at the same time, it's helping you with increased antioxidant reserve. So it's balancing itself out. So most things will do one or the other. Most things will either increase the amount of energy that you make or increase your antioxidants. So you can take antioxidants Yeah, anybody knows about vitamin C or glutathione or vitamin D, for example. These are antioxidants. You can take things that enhance energy. Something like caffeine will increase energy. Something like nicotine, for example, although people don't like nicotine or get scared of it, nicotine's a fantastic cognitive enhancer. And it works really well because it increases neurotransmitters that are related to increasing energy production, and specifically neurotransmitters like dopamine, norepinephrine, et cetera. So there's very few compounds out there that do both at the same time. And it's not only that, methylene blue is also working by changing what's called the conformation of hemoglobin, which is the molecule on your red blood cells that carries oxygen. So it makes it easier for hemoglobin to dump more oxygen into the tissue. And as a result of that, what's happening is that you're basically revving up the whole process of energy metabolism. So you're increasing the pool of NAD plus as well, because you're increasing the pool of the need of that, because you're increasing the energy production in the mitochondria itself. So you're also increasing nitric oxide if you're using low dose methylene blue as well. And high dose actually has the opposite effect, so you have to be careful about that. But all this together is creating a supportive mechanism in your mitochondria. And for a lot of people that have mitochondrial dysfunction, what happens is the first couple complexes on the mitochondria don't work very well. Typically complex 1 and complex 2. There's 4 total, okay? The first 2 complexes are the ones that get electrons from your food. You break down food, that's why we eat really, is that we break down our food so we can make energy. Break down our sugars into glucose, break down our fats into fatty acids, and that can get put into the mitochondria and then into something called the Krebs cycle that allows you to make energy. But if your mitochondria aren't working that well, you can't use those electrons very well and put them into your mitochondria to make energy. What methylene blue does is it bypasses those first couple complexes of the mitochondria, so if they're not working very well, you can bypass them and increase energy production even still. And so this is why it's so great for people that have mitochondrial dysfunction, as hopefully they're doing I know it's the hard work of truly trying to regenerate and optimize and heal their mitochondria, heal their body. But this is a great way to support the system as they are trying to do that.
Yeah, that's so cool. The first time I read that because the places where people with long COVID and ME/CFS, where we're noticing that there is trouble making that energy, is in those first 2 phases or stages, or I can't
complexes.
remember.
Yes.
Yeah. And so it's crazy and amazing that methylene blue just jumps in there to the, that last part of it, so that it can just create that energy.
Yep, and it's called complex 4. Yeah, complex 4 or cytochrome oxidase for those who care. But it's a pretty amazing. It's also revving up the whole genetic expression process as well. So you get more complex 4 in your mitochondria as well. And you're also stimulating the production of all these antioxidants, not even just methylene blue itself, but you're actually stimulating the whole NRF2 pathways, which are these pathways that help you make more of these antioxidants to help neutralize the system. And so, I mean, I've seen amazing things over the last couple of years, Lorrie, and I was talking to you about this on the podcast. And I've seen people with brain fog for years take a couple of days of methylene blue, then it goes away. Their joint pain go away. Their blood pressure get better. Their symptoms that have been ongoing for quite some time just get better. And it's not always right away for people, but it can be pretty dramatic when it happens quite quickly. I mean, I was just talking to a practitioner, was it just yesterday, and she was talking to me about a patient that had brain fog post-COVID that wasn't getting better. She had tried a whole bunch of things and it wasn't improving. And then what she did was, let's try these methylene blue troches that you guys make. And she just gave him one pack, one pack in a box like this. And he took it for 2 days and his brain fog was gone. And he's like, do I need to keep taking it? That's what he said to his provider. I was like, see how you feel. If it goes away, then you don't need it, right? But if it's something that helps prevent it or helps, work if it comes back, then please continue to use it, right? So pretty cool.
That's amazing, amazing, amazing. Yeah, so a couple of questions, really good questions that we've had come in. And the first one is if this helps with COVID, with the COVID virus, which I ran across some really interesting studies about that recently. So can you talk to that a little bit?
So the short answer is what methylene blue does is increases energy, right? And also increases antioxidant reserve, right? So if you have an inflammatory condition or a condition where there's less oxygen available, methylene blue can potentially be very supportive in that case. Now, we can't say as a company that our products or methylene blue itself can treat any particular disease
Yeah.
itself, but it's more about the physiology of what's going on underneath that, right? So as a clinician, personally, outside the company, I've been using it for everything that you can imagine where there's an inflammatory aspect or there's an infectious aspect or a combination of those causing mitochondrial dysfunction. And is COVID one of those? Yes, sure, absolutely. I've been doing that all the time. Early in the pandemic, we were shuttling out our products to all these kinds of places you couldn't even imagine because doctors wanted them. And my colleagues wanted them and they were keeping people out of the hospital. Okay.
Mm.
So it was a big deal, but we weren't ever selling our products for COVID. This is something that can support your patients if you choose to use it. And we have a lot of practitioners that use our products in their offices and have them for sale there. And that's one of the main things that I do is educate all the practitioners. And so I do webinars, I do education, et cetera. And this is the feedback that I was getting almost immediately when we launched the product in June of 2020. And I still get it today, but now mostly it's on the other side of it, which is the post-COVID side, which is the similar presentation to what you've been so passionate about for such a long time as well, Lorrie. So, but yes, the short answer is yes, but the long answer is it's more focused on the physiology piece, right? And we're not a medical treatment for anything. We are a supportive formula to help optimize the system.
Yes, yes, yes. So yeah, Catherine, we're going to get into dosing in just a bit here. And would you recommend this for cancer? Simply need, this is going to be the same question. He just answered that basically. And this is a great question. Mine comes from a compounding pharmacy. Is it as good as yours?
Right. So compounding pharmacies will typically be dosing pretty high dose methylene blue. What we've done is that we've dosed it much lower than that. We've lowered the dose down to about 16 milligrams per troche. So we make these things called buccal troches. They come in a packet like this. I'll show you guys for show and tell purposes what they look like. And so what they do, so what we decided to do is go super low dose because the doses that we decided to try or decided to use were studied for mitochondrial function, especially for brain function. So we were looking at dosing for mild cognitive impairment, Alzheimer's studies, and that's what we used our dosing in. We used our dosing as a result of those studies. And what we've noticed over the last several years, especially working with clinics and working with patients, is that the lower doses are really great as a supportive. They help with mitochondrial optimization. The higher doses, like 1 milligram per kilogram or more, which is what we call a higher dose, these are really great doses for short periods of time for acute issues or for like short periods of time during a chronic issue, as long as you're supported. But the challenge with the higher doses, like you're talking about 70 to 100 milligrams a day, is that they can also affect your gut microbiome. They can affect the biofilms. They can cause GI ulcers. They can also cause toxicity over time if you're staying at higher doses, because methylene blue's got this interesting curve. It's mitochondrial optimizing, but if you take too much of it, it actually can have the opposite effect, and it can cause too much stress, simply only stress to the mitochondria itself. So we use very, very low dose, somewhere between, so typically my clients that I work with will be taking like 8 to 16 milligrams on a regular basis, depending on the indication, sometimes higher. I see somebody's asking about 25 milligrams per capsule. And so that's a pretty normal dose for infection treatment. So like for Bartonella, for example, that's usually the dosing that's used. And I think that's fine, especially if it's being used in combination with other things. I think the key for just people to realize is that the lower dosing, 8 milligrams, 16 milligrams, even 25 milligrams, is still on the lower end of the scale. And that's very safe, and it can be used regularly at those doses. But I find that if you're going to use it regularly, it's better to be on the lower side of the dosing, somewhere between 8 and 16 milligrams. Even on the 25 milligrams and a little bit higher, it starts to get more to the point where you're causing maybe some of the gut biofilm issues. And because the 25 milligrams twice a daily is actually to address the gut biofilm of Bartonella specifically. So trying to keep it low dose is not affecting the gut microbiome as well. So, but that's a really good question. And then there's just the other piece of that is that what you get at a compounding pharmacy is as good as what we make. We make a pharmaceutical grade methylene blue product. So hypothetically, your pharmacies would have pharmaceutical grade methylene blue. as well that's compounded for you. But some of the other companies out there, you have to be really careful because you really don't know what you're getting. Methylene blue is also often contaminated. It's contaminated with heavy metals, unfortunately. This is because for various types of sources, unfortunately, it's still used in a fish tank cleaner. And fish, as an antiseptic, it actually works to help keep the fish healthy. But that's a contaminated type of methylene blue. So you wouldn't want to go to your fish tank store and buy methylene blue or something like that. Okay. But so we use what's called USP grade methylene blue in our products. And not only that, we test it again when we get it every batch to make sure that it's still clean, because it actually took us like almost a year longer to launch our first products, Lorrie, because we had a hard time sourcing a clean source of methylene blue. So it's just be careful out there. But yes, those are good questions. This is what a troche looks like too. It's got, you can see there. I don't know if I can look up there.
Yeah,
can't really see the.
Yep.
You can't really see that, but it's scored, which means that it's got lines in it, so you can make it either into a quarter, a half, or a full, and you can use it that way. It's buccal, which means it goes between your upper cheek and gum and dissolves there. But you can also just swallow it if it's just methylene blue itself. We have some methylene blue swallowed is just as available to the body as if you put it buccally, but buccally here just makes it absorb to the brain a little bit faster. So in my patients with brain fog, my patients with concentration issues, I try to have them dissolve it in their mouth, even though the mouth is going to turn blue for a little while. Yeah. But it makes their brains turn on, so that they don't care, right? But otherwise, you can just swallow it, and it gives you full, mitochondrial optimization that way. We have a couple other products that are better buccally. We have one with methylene blue, nicotine, caffeine, and CBD, and that particular product is better in the buccal cavity because it's more for focus, more for getting things done, more brain turn on. It's kind of like our Adderall-like effect without the tolerance withdrawal and all the side effects of being on that. But that's a big issue for a lot of people that are in this space, unfortunately, too, is that they need something that's going to make them concentrate and focus, but they don't want something that they're going to pay for 5 days afterwards.
Yeah.
And our blue carnitine is one of those products, too, that can potentially be helpful, which is the one I was talking about with nicotine, caffeine, CBD, and methylene blue. But I usually have these people that are on the sort of the chronic fatigue, myalgic encephalitis, long COVID stuff, start with the just blue first, and then graduate once their system seems like they can tolerate it okay.
Yeah, that's great, because I know that caffeine is not the best thing for people with these issues of long COVID and ME/CFS.
Not at all. So that's the thing. So that's why I never want people to start there. I always want people to start off with just the methylene blue itself, which is, as we described, right? It's a supporter of the system. We call it it's a combination of two things. What we call a health optimization nootropic. So something that helps with brain function, but also helps the system's health itself, the brain's health. And then at the same time, it's got some performance optimization nootropic aspects to it, meaning that it helps the brain perform better because it's actually helping release some neurotransmitters that are responsible for performance, like norepinephrine, dopamine, and serotonin. And so there have been some studies using methylene blue for things like depression, for example, for this reason, and helping with mood boosting. But that just leads to the other issue, is that you don't want to be taking methylene blue, most likely, if you are on drugs that are serotonin reuptake blocking. So there could be a potential combination and potential side effect. Very, very rare, though. I will say that there are clinicians that are using these in combination. If the methylene blue is low dose like ours, and their SSRIs or SNRIs are very low dose as well, just under medical supervision is what I would recommend.
Cool. Perfect. That was my next question. So we took care of the contraindications. And there is one other weird contraindication.
Yeah, so there's a couple more. You don't want to take methylene blue if you're pregnant. And if you're breastfeeding, you're not supposed to either. And high doses of methylene blue, you have to be worried about a particular type of genetic problem called G6PD deficiency, which is it's basically a genetic thing that you're born with that makes your red blood cells more sensitive to stress. And so it's pretty rare, but not too rare. It wouldn't be something you need to have an issue with if you're taking like something low dose like ours. But if you're taking higher dose, I would recommend you get a G6PD test. It's just like if you're taking high dose IV vitamin C, for example, you'd want to take the same test.
Awesome. Okay, so let's bring in the other aspect of what we're talking about here today, which
Red
is
light.
red light therapy. Yeah, what is that? And then we'll talk about how they work together, how the Wonder Twins activate and unite.
I'm gonna take some methylene blue right now. So here you go.
Nice.
So red light therapy. So what we're talking about here is the red light and the near infrared light spectrum. Typically, the studies that have been done there's been lots of studies that have been done on red light therapy, but what we're talking typically here is about 660 nanometers in length. And this is red light. This is typically something you can see. You can get red light from the sun. That's where it comes from. But you also can get red light from devices like red light panels and things like that. That I think both of us have in our house someplace. Mine are in my basement, next to my hyperbaric chamber. So what red light therapy does, it does a number of different things. But what it does also is it works on the same complex as methylene blue, that complex 4 in your mitochondria. So again, you have these 4 complexes in your mitochondria. They work in synergy, so electrons kind of go from one to the other. And then as a result of that, you make this gradient. And complex 4 is the final one. And what red light therapy does is it donates photons to complex 4. And that photonic energy gets transferred into electrons and then creates this increased energy production as a result of it. So you get increased energy production in your mitochondria as a result of red light therapy. And so methylene blue in combination is working on this same complex. So what you see is a synergistic effect, both at low doses of methylene blue and also at high doses of high doses of red light and methylene blue. So at low doses, you get a synergistic effect with mitochondrial optimization. You see increased energy production. You see increased antioxidant reserve. People will feel this typically. They'll feel like if you go out and have your methylene blue, and then 30 minutes later, if you take it buccally, or maybe an hour and a half later, if you swallowed it, go outside, you will feel a difference. You will feel like this activation. And that's the thing about methylene blue in general, is that it's not like it's a nootropic in the sense of like, you won't feel like your brain is like, holy crap, oh my God, I'm so focused, I'm so on. It's more of like this sort of subtle rise in how you feel. And it can be more pronounced in people with brain fog and concentration issues, but in general, it's not like you're so amped up, right? Like which can happen a lot of these, like caffeine or something like that. It's more of like this slow rise. And then so when you increase energy production with red light therapy, you feel a slightly more amped up energy, right? It's not like you feel super jittery or anything like that. It's more of just like the super amped up energy that you feel. And it's a fantastic combination. Like, it really is.
Yeah. Now, I also understand that methylene blue has some antimicrobial properties that are activated more fully with the red light therapy as well. Is that right?
So yeah, at high dose of methylene blue, and then more concentrated, powerful lasers called photodynamic therapy specifically. That's when you can see the inactivation of particular viruses and antibacterial potential as well. So it's interesting, like even though methylene blue has been around a long time, we're not exactly sure how it works to inactivate as an antimicrobial, but we think it works on the cell walls of bacteria and also like the capsids, encapsulated viruses. So working on the capsule itself and somehow breaking it down. And it seems to work better when red light therapy is around. So you'll have people, like in the beginning of the pandemic, I had people doing intravenous IVs of red light, with methylene blue orally. And so they're getting IVs of, whatever nutrients or things like that. But they're also getting red light in the IV itself. And like they're going, negative in 3 days, with COVID and things.
Wow.
So I think that like it's an antiviral at higher doses is what it comes down to. So high dose methylene blue, like greater than 1 milligram per kilogram, typically in that case.
Okay. Gotcha. Now, I've heard of this before, getting red light therapy through IV, but how the heck does that work? How do you get light into a vein?
So the actual catheter itself that goes into your vein. So like if you ever had an IV before where you have a catheter that goes in, it's actually a catheter that shines light into the vein itself. So it's local, but it seems to have a systemic effect when you do that. And I haven't used it in my clinical practice, but there are a number of different providers that I work with that use it and have had lots of success using it as well. So
That
yeah.
is crazy. That's crazy. Oh, and I wanted to mention to the other person who was asking about COVID and methylene blue,
Yeah.
and just to say that you can Google methylene blue COVID
Yeah.
study, and you can
There's a
find
number of
those.
studies that have been done. Yeah.
Yeah,
Yeah.
yeah,
And they had some pretty significant success. The challenge of methylene blue, many of your listeners won't be surprised at this, is that there's not a lot of money to be made by pharmaceutical companies and others because it's off patent, right? It's been around such a long time. You can buy it over the counter. You can buy it from my company, from Troscriptions. So there was no financial incentive at the end of the rainbow to do studies on methylene blue or do less studies on vitamin C or even vitamin D and things like that, as we now know are so important for not only COVID, but also as antiviral treatment for many, many reasons, right? So it's challenging when there's no pharmaceutical billion-dollar unicorn at the end of the rainbow to get these studies done, unfortunately. But there is some studies that people can look up pretty easily.
yeah, yeah. Yeah. So let's talk about some more of the
Yeah.
logistics. And you talked about how to dose, but for our people with MCAS, so mast cell activation syndrome, with long COVID, with ME/CFS, a lot of them are very sensitive, and
Right.
maybe also with other chronic illnesses. So they tend to respond to things in ways that are not like other people respond to things. So for those people who are super sensitive, how would you suggest they start out with your Troscriptions methylene blue, with the Just Blue?
That's why we've dosed them the way that we have, because I found that in a lot of my chronic complex medical illness patients and the people that have had longstanding symptoms, like you got to go really slow, because we've been talking about in generalities, antimicrobial doses are at 1 milligram per kilogram, but I've seen people start hurting or detoxing at like 4 milligrams before, right? Super low doses. And is this an antibacterial effect, antimicrobial effect? Is it that their mitochondria aren't working well at all, and even a little bit of support, a little bit more energy production is causing some additional stress on the system? It's probably a little bit of combination of both, honestly. It depends on the person. So the key really is to start low dose, especially people that are sensitive. So that's why the troches are scored. And so you can start taking just a quarter and then see how you feel there. And then if you're doing okay in a quarter, then go to a half. And if you don't have any major shifts and no difference in feeling, then I typically have people kind of go up by either a quarter every week or so, or even every 3 days, depending on how they're doing and what else they're doing. But what I found to be helpful, especially people that are on the earlier side of their journey, is that regular dosing can be really helpful here, because while you're getting yourself, while you're working on the mitochondrial pathways and detoxification systems, this is a way to really support the system. But you really do have to start very low dose and just titrate up slowly. But it can be used regularly. It can be used daily, which is great. And that's what we also formulated it for. So you didn't have to, you didn't have to worry about our dosing being something you couldn't take every day. So it's something you can take every day at low dose and not worry about toxicity. And it's something that can really support the system. It may not be something you need to use forever. I mean, the hope is that, like, once you can optimize mitochondrial function, you only need it when your mitochondria are under more stress. So, like, for example, my voice is iffy today, so I'm higher on my methylene blue dosing. Or if I'm traveling, I have more methylene blue, for example, but I'm not using it every day personally. And my clients that are pretty well optimized, we're just using it periodically when they need it, right? But like when you're going through a lot and you're inflamed and you have a lot of toxicity and your detox pathways aren't working well, regular dosing can be really transformative. And so, but going slow. So in people that are even super sensitive, like we've talked about, like, don't put it in your mouth first, just swallow it, because sometimes that's going to make it so it won't be as much sensitivity. Also, even if I say that you can put it into quarters, in some of my clients, I've used even 1/8 of it to start off with. Now, the first couple of days you take it, we don't get a lot of side effect reports, but one of them is some people can get some headaches when they first start. And that's oftentimes because their brain isn't used to making more energy. And so their brains are like, whoa, this is not cool. Like, I'm not used to the energy. So they get headaches. They'll usually get better over the first couple of days, as long as the headaches aren't severe, of course. If they are, then please, stop and talk to your doctor. But usually, they can get a little bit worse before they get better, kind of deal. When you're starting to make more energy, the system is like, oh, this is great, kind of, not really. And then, but the good thing is that you have the antioxidant support there too with the methylene blue, but just something to be aware of. It's a really good question.
Yeah. And also, because I've had a couple of people report back, a couple of my students report back that they got kind of constipated, not too badly, but I'm wondering if you've run into that before too.
Not too much. But I guess, when I think of constipation, I usually think about it as sort of a detox kind of thing, in the sense that their GI system probably needs a little bit. I think you actually emailed me about that in some of your patients or some of the people that you work with. And so I think of when there is specifically fungal die-off in the gut, that can cause bloating and constipation. So just being on top of that, and people that that have fungal overgrowth is important. So like in my patients, I'm always thinking about, what do I need to do to support their GI system if they're going to have fungal detox? It could be as simple as making sure they poop every day by giving them, some magnesium, for example, or it could be something more dramatic like ozone rectally, or something like, you can do coffee enemas, or you can do colon hydrotherapy and things like that. So I've used all those things in the past, but obviously taking something from above is preferable for most people, which, magnesium tends to do the trick for the most part. So.
Yeah, great. So, okay, so back to combining this with our red light therapy. So I'm assuming that it's going to be best for somebody to get up to a decent amount, a decent, dosage before adding in the red light therapy. Does that follow? Is that what you?
I think it depends on the reasons you're using it. I think like if you're super sensitive, yeah, right. Because if you're super sensitive to everything, I would definitely add things in steps and not just blast yourself with 20 minutes of light after your troche. But I think if you're using it more for like health optimization purposes, for just optimizing performance or recovery, then you can definitely use it. In that case, you don't have to wait. But if you're super sensitive, like everything else, go slow and add one thing at a time, and then make sure you're tolerating one thing before you start, stacking something else on top of it.
Just throwing everything at it. Yeah. And then how long, I think you mentioned this before, but how long after you take the methylene blue do you need to wait before you do the red light therapy?
So you want it to be in your system. That can be, if it's a buccal troche, about 30 minutes to an hour. If it's a swallowed pill, or if it's a swallowed troche, then about an hour-ish to an hour and a half if it's an empty stomach. If you're going to swallow methylene blue, it's a point to kind of put there, is that you want to make sure you try to swallow it on an empty stomach, because it'll absorb faster that way. Yeah.
Okay.
Yeah. Now again, if you're super sensitive and you want to be super careful, then you can take it with food initially, and then ideally you want to take it on an empty stomach. So what I'll have, some of the first people that I was working with in this world with methylene blue, what they were doing is taking a quarter in their mouth a couple times a day to help with brain function, and they were swallowing a half at night to help them sleep, because sleep is a very big challenge for a lot of people with chronic fatigue and CFS and things like that. So and long COVID, so they were helping, that was helping them sleep, and that's actually been pretty significant across most of the people that I've worked with chronic inflammatory issues, that like they need help with sleep. And so methylene blue, even though it's supposed to give you energy, it doesn't keep you up if you swallow it. You swallow it, you go to bed, and so for some people it can really significantly help them sleep too.
Awesome.
Yeah.
Awesome. So ideally speaking, if one were for people who have a chronic illness, if they're kind of working up to a daily regimen of methylene blue plus red light, what would you recommend as far as amount of time per day and number of sessions, or amount of time per session and number of sessions per day?
Yeah, a really good question. It really depends on the reasons for using it. If it's more for like a daily health optimizing kind of thing, low dose, somewhere between 4 and 8 milligrams a day is probably enough, just to support the mitochondrial function and just optimize energy, enhance energy, increase antioxidant reserve, the things that we're talking about. And then red light therapy, anywhere between 7 and 10 minutes, like an exposure on a side, is typically enough to really get a significant bump in how you feel. If you're looking at more from like a chronic fatigue and post-infectious, autoimmune, inflammatory, maybe higher dosing than that. It may be somewhere between 8 and 16 milligrams a day for some people, or sometimes maybe 3 to 5 times a week, depending on how they're doing. A lot of this is like, unfortunately, is feel for people, right? In the sense of like, if you're taking it for daily health optimization, it's not something that you can potentially feel. That's what we call this is like our daily blue vitamin, right? This is our, for me and for the people that I work with and for my team, the Troscriptions team, this is something we take mostly throughout the day, like most of the time, right? We don't take it all the time. We do take time off, although there's no data that says you need to stay off it for any period of time. Like most things, I think it's pretty good to cycle overall, so you're not taking something all the time, unless you absolutely need it. Like you need the mitochondrial support while you're doing the hard work of optimizing mitochondrial function. But in general, like for like a regular regimen, it's methylene blue, somewhere between 4 and 16 milligrams a day, maybe 5 days a week, and then maybe 7 days if you really need the support, and then red light therapy about 30 minutes to an hour afterwards to really supercharge your mitochondria together. So, but that's, again, everybody's going to have to feel it out and know that not everybody's going to feel super different when they take it, and that it'll also be situationally. Sometimes you'll feel much better when you take it. Other times you might not feel as much. That usually means you needed more that time when you didn't feel as much. So, I mean, that's what I found over the years. So that I've been trying this.
That's interesting. So I want to talk about the pee because I think it's fascinating.
Oh, sure. I'm sorry, I'm like hammering my drink, so we're talking here because my throat.
Yeah.
Yeah, so your urine does turn blue when you take methylene blue, and because methylene blue concentrates in the urine. And something I think we talked about in your podcast, Lorrie, is that, or for your summit, is that there is some indication that the color of your urine is an indication of how much methylene blue your body needs. Now, we don't know for sure, but what I found with my clients and personally is that if I'm pretty well optimized at lower doses, your urine will turn blue earlier. But if you're not as well optimized, like I haven't been feeling well the last couple of days, I'm taking higher doses of methylene blue, my urine isn't as blue. And I think it's because what's happening there is your body's utilizing more of it. So, and as a result of that, you can sometimes, I don't know if this is going to be for everybody, but I think a certain subset of people can actually titrate their dose to how much they need by how blue their urine turns. Now, I'm not talking like a mild shade of blue. I'm talking about like, wow, my urine is blue kind of thing. Like, and I've seen that before. You wake up in the morning and some of my patients will say, and Dr. Scott, you didn't tell me how blue my urine was going to be. I'm like, oh, this is good news. This is good news.
Yeah.
And how blue your urine is. So, and I've worked with people that are like high performers and athletes, and like they'll get a certain dose that they find is really good for them. But when they travel, they need more to get that same blue urine. So anyway, so we don't know for sure. It hasn't been studied, but it seems like there is a correlation between how blue your urine is and how much stress your body's under. So basically, the more stress your body's under, the less blue your urine will be at a particular dose, most likely. And so this is a way you can kind of titrate your dose a little bit.
That's so cool. It's just so cool to me for some reason that you can actually, I mean, I feel like the more control we have over knowing what's working and knowing kind of where to go with dosing and things like that. And like you said, it's not 100%. We don't know for sure, but you know, the concept is cool.
Yeah. I mean, clinically,
go ahead.
I was just going to say that everything, unfortunately, is not black and white in the world that you live in, Lorrie, and the world that I live in, right? So it's all about nuance and, you know, looking at people and how they're doing and how they're feeling. And what my company really tried to do is create products that could help you now while you're doing the hard work of truly optimizing your health and working on the foundational aspects of vitamins, minerals, nutrients, gut health, neurotransmitters, hormones. I mean, working on infections, like that stuff needs to happen, but it takes a while. So what Troscriptions was developed for was to truly optimize you now while you're doing the harder work. So we have our Just Blue, which is our pure methylene blue product. We have Blue Carnitine, which is our focus product that gives you that 3 to 5 hours of focus, flow, verbal fluency. In so many of our patients, so many of my patients, I should say, that, and people that I work with that are trying to get their patients off of some of these drugs that are basically amphetamines, right? And then we have another product called Trocom, which is a combination of GABA, CBD, CBG, and kava that works really well for people with chronic stress and chronic anxiousness. And it helps just decrease all of that beautifully in a way that they can actually function because their brain is not so sympathetically dominant, like so stressed all the time. And it helps them sleep because it helps turn their minds off, quiets their mind before they go to bed. You were talking about constipation before. Dr. Ted, my colleague, the guy that founded the company, likes to call Trocom our thoughts to patient. So it makes your thoughts not come. And so as a result of that, you can go to bed. Like you have that perseverating thought that won't let you go to bed. All of a sudden your mind's like, I'm good. And then you just go to bed. Yeah. So anyway, so we have those products, but the key for everything always is in context, right? We hope that you don't need our products forever. And that's different from my company than most, because we're not trying to, have you take something forever. I think that the key is to do the groundwork, the foundational stuff, and then hopefully you only need our stuff every once in a while. That's my hope.
Yeah. So I just want to come back to that again. So even though Methylene Blue does all of these wonderful different things, and then added to the red light, or adding the red light to it, it does even more. But as you have said a couple of different times, it's not the only thing.
Right.
Yeah. Because I know that you have that same approach of, can you talk about that just a little bit so we make sure that people understand that getting Methylene Blue and a red light is going to be a great addition.
Right. Yeah. I'm so sorry I have to run after this too. My kids are yelling at me that I have to go. But the key always is that even though, like you said in the beginning, Methylene Blue was the way the term magic bullet was coined, there really is no such thing as a magic bullet, everybody. I know we all know this, but I know we all still want them, right? And so the key is to look at things in a more global context as much as possible. These are tools. These are formulas that can truly help you. Methylene Blue is a fantastic way to do that. But it's not going to take the place of getting your foundation in order, optimizing your health. And so it can help you along that path for sure, but just be aware that everything needs to be done in context. And so my company, Troscriptions, is here. We're going to be making more products that I hopefully will be helping a lot of people, but the same message will always apply, is that these are great, but these are not magic bullets. There might be a magic bullet right now, like for this moment, right? But they're not going to be a magic bullet forever, like in the sense that Methylene Blue might in 2 days make your brain fog go away. But that's not likely going to be the issue. It's not going to be something that's going to help you over the long term, most likely. Only it's going to be something that helped you initially while you're doing the other work, the harder work, right? The same thing with calming you down or giving you focus. The key is in this context, this holistic context, and so that's where we live, and that's where we can continue to make products. I hope. Yeah. Perfect.
I love it, Dr. Scott. Thank you so much for joining us, and to all of you out there, I'll have a link to Troscriptions for you probably in the description or the comments. And yeah, just so appreciate your time. Thank you for sharing your precious time with us and your knowledge. And
my pleasure, Lorrie. Thank you. Yes, if anybody has any questions, they can leave them in the comments, and either myself or one of my teammates will try to get to them as soon as we can too. I'd love to hear what everybody has to say. So
perfect. Yeah. All right.
Okay. Be well. Soon. Bye, guys. Take care.
Bye.